by Professor Marc from the University of Haifa and NATAL, a preliminary study of video testimonies of individuals having undergone traumatic war and terror experiences. Marc, בבקשה.
Good morning. I don't really know if I have very much to add after these beautiful lectures and extremely interesting lectures, because these lectures and what I've heard here until now is really my basic understanding, my basic acknowledgement that testimonies and that the fact of witnessing these testimonies are basic to our being human beings. And mostly this happened through our acknowledging the narratives of other people and being in this place of witnessing the narratives of other people. What I would like to add to this, to these lectures is the question, and trying to answer the question whether basically testimonies also have some kind of therapeutical impact, and if so, which kind of therapeutical impact. The literature in the domain does show that disclosure, basically the disclosure of emotions, the disclosure of the narrative, the disclosure of the inner experience of the person has some kind of therapeutical positive influence on people. And most approaches in this domain have used narrative writing techniques, and it is quite new and it's quite recent that these video techniques have been used. Most stories in the literature have shown us that it's anecdotal and qualitative in quality. It's qualitative, and video testimonies have shown to be effective in helping trauma-exposed individuals, and very few quantitative studies have been held. So basically the aim of the current study, and it is indeed a pilot study, is first of all to give some primary, is to ask the general questions whether, first of all, who is interested basically in testimony? Who comes to testimony? Secondly, what is the clinical profile of those people that come to testimony? Thirdly, what do people or clients, people that come to testimony, what do they want? What do they think they will gain by doing video testimony? And after the testimony, what do they feel they gained? Because it's obviously not the same. They do not get into testimony with the same ideas when they get out of testimony. And does testimony have any therapeutical impact? And for whom? Who are the people who are going to gain? Is it going to be the people who will be more traumatized or less traumatized? And in what way is the video testimony product, also this disc that they will have in hand, some instrumental? In other words, what will they do with the movie, with the kalettet, with the tape, or with the disc that they will receive? So the aims of the current pilots are as such. First of all, giving us some primary leads about the aforementioned questions. Secondly, refining the research tools, because this is indeed a pilot study. Providing a better understanding of what participants want to receive and what they attain from doing video testimony. Trying to understand whether the video testimony is only a personal process or if it's a wider social process. And the most important question, and what personally most interests me, is just opening questions about video testimony on all levels. At the level of methodology, it is important to understand that the recruitment was mixed. This means that we had people coming in through news campaigns, we had people coming in through therapists at NATAL, And we had people coming in through Awake at Night, which is Erim Balayla, if you know the organizations. People were invited to do testimonies. People were not invited to do video testimonies at the beginning. So they did not know basically that they were doing video testimony. Only afterwards it was told to them. About 85 people applied to doing video testimonies. 15% left of their own volition. Half of the 15% left of their own volition, and half of these 15% were refused or were proposed not to do it. For this pilot study, I'm going to present to you only the post-assessments were done. We preferred starting slowly. We didn't do a pre-post. This is something we are already doing and will be presented in the future. And subjects were asked to fill in questionnaires. Now, what happens in organizations and in therapeutics or certain settings that are sometimes a little afraid or that might be wary of questionnaires, because people are often wary of questionnaires. The result of this is that the subjects were not prodded and not really pushed into filling the questionnaires until the last item, which is fine because we are going on with this research. The current methodology was based upon only 24 clients, which filled in large questionnaires about demographics, event types, treatment history, post-traumatic symptomatology, expectations and influences, like I said, and actual behaviors, actually what they did with the CD they received. We had 24 clients, 3 females, most 75% were married, and we had about 20% which were widowed, and 4% who were single. About 1/5 are what I would call the forgotten generation, which basically means that they went through their trauma either during World War I or during the War of Independence. What? World War II. Okay. World War I, they're not here anymore, most of them. Then we have a few people that were from probably which we could call the lost generation. Okay. Well, I will just continue. We had, you hear? We had a few people that were from the lost generation, which were from the 50s and the 67 war. Then we had about half of the people that came from the Yom Kippur War, people that were traumatized from the Yom Kippur War, and very few, and a few people, not yet. Okay. 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 Sorry for this. Most people that came were traumatized during the war. About 1/3 of the people were also POWs. Good. Most of the people that came were also 1/3 of the people that came were also POWs, and a minority were people who were only victimized by terrorism. Now that we've gone through the preliminaries, about 75%, close to 75%, had extremely low levels of post-traumatic symptomatology. 75% did not have any any serious symptom of post-traumatic symptomatology. 1/4 did have serious symptoms of symptomatology. When looking at the data, what is very interesting to see is that these 75% had very low symptoms, and then we do not have anybody who had intermediate levels of symptomatology, which kind of suggests that maybe what we have is either people that come and tell their stories, their narrative, and they succeed in living their lives quite well, and 1/4 of the people that come are really traumatized and maybe using this module, let's say, this approach to help themselves as a kind of therapy or self-help or a way to redeem themselves or a way to work upon their issues. Yes, and this questionnaire is really top of the art questionnaire, real questionnaire, not just a few questions about do you have post-trauma. Oh, okay. What kind of expectancies did people have when they came? Many, take me some more time because you don't have this in front of you, only I have it. People came for a number of reasons. People came to find some emotional relief. Only about 1/3 came to find some emotional relief, but interestingly, close to except for the one with binoculars. Interestingly, about 2/3 of the people did find some emotional relief. So basically people got much more emotional relief than what they thought they would get. The same thing counts about clearing things up for myself. About half of the people thought this would help them clear things with themselves, but much more got out with the feeling that they did clear up things for themselves. About 1/3 of people thought that it would bring up memories. Also very interestingly, 2/3 thought, for 2/3 of the people it brought up memories, which is not surprising because it's difficult to think about memories that would come up if you don't have the memories at the beginning, at the onset. But the result of these testimonies are really the fact that people start remembering things that they did not remember before. 60% also felt that it closed, that it made a kind of, that it closed a circle for them, that it answered questions for them, that it made kind of a sense, that it closed the story for them. And 76% felt that it created, that it helped them create a continuous story. 68% said that it helped them to express a social message, which kind of says that these people had a social message to convey to society and to their loved ones. A lot of people came to testimonies, about 60% came to testimonies with the thought, with the basic intention to help other people. When they got out of it, much less thought it would help other people. They did think they had a social message to convey, but they did not especially think that it was to help other people. When looking at how it really affected their own lives, more than 60% of people thought it really helped them ease their own personal distress, ease their own emotional problems. But it didn't really help most of the people in their work-related life, for example. It didn't affect people in their working life. It somehow helped about 1/3 of the people in their relation with their children, which is interesting. It helped about also 1/3 of the people in their relation with their spouse. It helped about half of them in their own relation with themselves, with their past. The basic feeling that they were cut off of their past, it kind of reunited them with their own past. Interestingly, it worsened for a number of people their relationship with the army. which kind of says it might have opened some old wounds that they had closed down. But again, I'm talking about very small sample, so it shouldn't be generalized to it shouldn't be definitive what I'm saying, but it might also open old wounds. It kind of, for 1/3 of the people, it also made them more at ease and more at peace with society overall. When comparing those with a high level of trauma and those with a low level of trauma, on the effectiveness, or in other words, on whether it improved some aspects of their lives, we do not see a real difference. We see a small tendency for people who have less severity to help them a little more, but it's not even statistically significant. It is just a small tendency and a direction we need to think of in the future. What we have found is that it helps people that are traumatized and people that are not traumatized in about the same way. The other way around. What did the people do with their disc? I don't know if it's a lot or not a lot, but about 60% watched it. The other 40% didn't look at it, did not want to look at it. Also 60%, and it's about the same people, showed it to others. They showed it to their family. Whom did they show it to? They showed it to their close families. They showed it to their spouse. They showed it to their children. Only a small minority showed it to friends or to other more further family members such as brothers. 60% probably considered it as a kind of legacy because they intended to give it to their family as, I don't know exactly what, a legacy, a testimony, give it to them as safekeeping, as a memory of their own self. Would they recommend it? How do they feel after this entire process? There were 15% who were kind of disappointed. They thought they would get more out of it. But even though 15% were disappointed, 95%, which means everybody except one, really would recommend it to anybody. Anybody who went through this experience, they really would recommend it. And this one person didn't say he wouldn't recommend it, he just said he didn't know if he would or if he wouldn't recommend it. So basically the experience is extremely positive. Those 57%, which is 12 people out of 21, because not everybody answered all the questions, there were a lot of missing values in this study. But 57% of those that answered that question said it has pushed them to try to express their experience in other ways. In artistic ways, or by writing, or by telling the stories to other people. So a lot of people, a lot of those that went through it, it was kind of inspiration for them to go on and continue this. The testimony is not the end of the way. It's not a question of telling your story and stopping there. It's in the disc and it's over. A lot of these people want to continue this. Probably felt they didn't tell all of it, because you cannot tell all of your story even in a few hours. So a lot of these want to continue the story. For some of the people who were in treatment, because not all of them were in treatment, they declared that it affected, for about 90% declared that it affected their treatment positively. And a small percentage that were not in any kind of a treatment declared that they would consider going to treatment. I forgot some of it. Okay. It's okay. So I'm going to finish this. So our conclusion from this study is basically that it is possible that PTSD sub-threshold, people that are not really PTSD, or what we call partial PTSD people, would not come to this testimonials, or maybe need to be prodded more to come to testimony. Secondly, that for all those people that participated, it had some kind of positive emotional impact. that it is empowering for those people, that in many cases it may foster enhanced social integration with families, spouses, and society, that it may be a potential therapeutical tool in the therapeutic arsenal, and it may be a positive addition to regular therapeutic treatment, that it is not yet clear for us with whom it helps and whom it doesn't help, and that maybe it might be helpful for different patients in different ways. Future research, and with this I will finish, will have to use better and more adapted measures as this study is ongoing. We should use more homogeneous samples, larger samples. We should do, and we are doing pre-post analysis. We should do correlational studies, analyzing the information of the quantitative studies with the qualitative studies, which we are sure will be very interesting, and do follow-ups. What is going on with these people 3 months, 6 months, 1 year after they did these testimonies? Thank you.